Hi, everyone. It's Anita Lambert, your holistic health physio, and Hannah Ross from Vital Physiotherapy and Wellness.
Hi, guys.
And we're excited. Hey, and we're very excited that today we're going to be talking about internal pelvic pain. And this is something that we see often in our physiotherapy practice. A lot of women come in with this type of pain, and it's through a lot of different stages of life. So we see women prior to being pregnancy experiencing this, women after birth, but then also after menopause experiencing the same symptoms. And so we're going to be talking about pain with intercourse, pain with using tampons, diva cups, pain with pelvic exams. All of this is what we're talking about when we talk about internal pelvic pain.
Yeah.
And so thanks for joining us. Please say hi. Let us know you're here. Let us know that you can hear us. And any questions that you have, please feel free to add them to the comments. We'll be sure to answer them right now while we're live or after the replay.
Yeah. And I mean, internal pelvic pain is actually one of the top reasons that we actually see clients. And often, I'm sure, Anita, you have the same thing. If it's not the primary reason that they come in, once we kind of get chatting, a lot of the clients that we see have pelvic pain as an additional symptom. So if, for example, they're coming in because they're leaking or they have back pain, once we kind of get the conversation going, we hear that they're experiencing that back pain, that internal pelvic pain. And I think that, like all of our other chats, our message here is, it's not normal and you don't have to live with it. So if when you're chatting with your friends, or your mom, or your aunt, or your sisters, and they're telling you they're experiencing this, please share this Facebook Live with your friends. If your friends, your healthcare professional, your family, it's time that more women actually start to get real answers. And we are hopefully going to provide many of those tonight. What I will say is we totally get it that lots of people may not want to post on this live feed, but both Anita and I are really happy to answer any of your questions. You can private message us. We want to help you get the answers that you need.
Yeah, and going along with that, we've had women come in with all various symptoms and have asked us every question you could think of. So don't be afraid to ask us questions. So whether in the comments or sending us a private message, we are definitely happy to answer and give you answers in regards to that.
Do you get that a lot? Like, okay, this is going to be really weird, but I'm like, trust me, nothing's weird.
Yes, exactly. Yeah. Excellent. So let's jump in. So why don't we start with Hannah? Do you want to answer, what is internal pelvic pain? Why does this, why do women experience this?
So, I mean, you chatted about it a little bit, you alluded to it, but really when we're talking about internal pelvic pain, we're talking about pain with sex. We're talking about people or even individuals who have pain with any sexual activity. We're talking about individuals who have, they can't insert tampons because it's uncomfortable. I think that people get really nitpicky with, it's not pain, it's just discomfort. To me, anything that doesn't feel like you touching your cheek, that, these things shouldn't be uncomfortable by any stretch of the imagination. Okay. A diva cup, if that's uncomfortable. Women who have, they ask their doctors to use the children's size speculum when they have internal exams. If they have, if they start to see that they have pain with touching the outside, the outside of the vagina, the inside of the vagina, even if they have pain with intercourse at any point in time. Like you'll tell me about your practice, but in my practice, I have a lot of women who say to me, it just hurts at the beginning. And I'm like, pain at any time is not okay. And so
it's pain, right? It's pain regardless when it is.
It doesn't hurt, it's just a little bit uncomfortable. I'm like, we can fix that. Like, why should we be okay with discomfort of any kind?
Yeah. No, I totally agree. And how I think it's really great to point out how you're talking about, Hannah. It's not only just internal, but external as well. So anywhere around the vulva. So we both have our pelvises here.
We're busting them out early today.
So anywhere around the vulva, so anywhere around the opening or in that area. is also considered, that is pain, right? In terms of what we'll be talking about.
I just pain around the rectum, right?
Yeah, exactly.
So, I mean, this is the question that everybody wants to know, Anita. What does pelvic pain or internal pelvic pain have to do with the pelvic floor?
Yeah, which is a really good question. And I know in past talks, if you've been watching us along the way, that we've chatted about kind of where the pelvic floor is. So just in case if you missed that, our pelvic floor attaches from our pubic bones in the front here to our sit bones and then to our tailbone. And there's 3 layers to those muscles. And this is what the pelvic floor looks like on the inside. So that whole red area is our pelvic floor.
I white mine too.
Yeah. And so so you can see where the pelvic floor exists and why a lot of times these different types of pain can happen is actually from tension or tightness in those muscles. So often I'll explain to clients, when you go for a massage and they get into your muscles, right? They're tender, they feel tense, your massage therapist may tell you, oh, these muscles are tight. Same thing can happen internally, and the only difference is our pelvic floor muscles exist internally. So unless someone's pressing on them or during intercourse or using a tampon, diva cup, pelvic exam, where those muscles are being pressed on, no one kind of recognizes that this is often to do with tension in those muscles. And that's why as pelvic health physios, we see this all the time and can address it. So that's really where it comes from is think of any other muscle in the body, if there's tightness or tension or, when you press, there's tenderness or pain with that is often talked about as tension or tightness in the muscle. It's the same thing with your pelvic floor, just on the inside, or again, it can be areas around the opening as well.
What I often have people do is I say, like, okay, if you make a bicep muscle, I'm just showing off my bicep muscle here. If you make a really tight muscle and you press it, it does not feel good. But if you just gently relax your arm and you press on your bicep, you almost don't realize, like, it's a completely different sensation, right?
Yeah, and then the other side too, which Hannah and I were talking about earlier, is another reason why, more specifically for women after birth, is if you've had natural tearing or episiotomy where they've had to cut somewhere around the opening during birth, they end up adding stitches and suturing up the area, which is, if tension often builds around that area, and if that's never addressed, and then you're going over top of that in terms of intercourse, or again, during pelvic exam, using a tampon, if you're constantly rubbing over that area, it makes sense that doesn't feel great, and that your body's reaction is to tense up, and that can be painful.
And women who have had cesarean sections understand why the scar tissue is like outside, and are often shocked when that whole system is tight, right? Because those abdominal muscles, they attach right inside, right over here, and that can cause tension in the pelvic floor as well.
Yeah, exactly. And I often will explain it. So a lot of women I see after cesarean birth, a lot of them do have tension in their pelvic floor. And I explain it as well. It's kind of like, because even if you didn't go through pushing, or if the baby didn't reach that part of the pelvis, still during pregnancy, there may have been tension in their pelvic floor already during that time, but then also after, because of the suturing and what they need to do further up top, the pelvic floor is almost trying to kind of help out the situation, and almost, we call it guarding the areas. So can also say that that's a possibility.
Right. And the other thing we were chatting about is during menopause, there are actual changes to the physical tissue in the area. And often when women are nursing or breastfeeding, we often call it like a mini menopause, because your hormone levels actually adjust as well. And that affects the tissue plumpness, so to speak. So when there's a thinning of the muscles, then that causes sometimes dry. Women have a harder time lubricating, and often that's a time when they would notice some pain as well. So it's not just postpartum.
Yes, exactly. And often, sometimes that can be the case that there's more dryness or not as much tone in the muscle, but often there's definitely a tension part of the muscle that we often see kind of goes along with that too, which can then contribute to that pain that they're experiencing.
Totally.
And then another part, so we've talked about also, I see a lot of women in my practice who are later on in high school or early in university age, and they have not had children at that point, and they're experiencing this pain. And they often, a lot of women talk about, they've had this pain since the very first time they've ever had intercourse, or the first time they ever used tampons, first time having a pelvic exam, and it's just always been super painful. Right. And if they've seen a physician, oftentimes they've seen many different specialists who have tried different things, and some of them do help to a degree, some medications or procedures, but that tension still persists. Right. And so what happens with them, so it's not about, necessarily having scar tissue going over top, but it's just those muscles have been tense for various reasons. Right. Yeah, protecting the area. And there can be various reasons for that for some women, if they've had a really stressful event. And it may have nothing to do with the pelvic floor. It could be another stressful event in their life. And oftentimes we keep tension in our pelvic floor.
Because it's not like your back where you notice it, right? Like if you had low back pain or low back tension, you go for your massage, right? But in the pelvic floor, we're not really aware in the same way of these muscles.
Exactly. Or that they are muscles. I think a lot of women come into our practice and don't actually know that this is a muscle issue that can be resolved. Totally. And so often can happen so stressful events, or in terms of abuse earlier on in life, whether it's sexual abuse, physical abuse, emotional, mental abuse. And those women often talk about that, that area has just always been painful, anything in the area. And for some women, it's gone on for a period of time that it's not even necessarily, the internal pain we talked about. It can be sitting for a period of time and they start to get a burning feeling on the outside, or very painful, or wearing certain clothing. So if they're wearing tighter clothing, tighter jeans, or, a thong, or any type of clothing like that, that alone,
anything touching an area,
this pain response.
Yeah.
So we want to, I know we're kind of, just kind of touching the surface of everything tonight.
Yeah, it's a very broad topic. I think that we're going to be covering, but even something as simple as having a UTI or bladder infection, sometimes is kind of like that trigger for women who have pain in the area, but are not necessarily postpartum or during or experiencing menopause, right? Mm-hmm. Yeah. And I mean, there are a lot of conditions that we treat where we see pain in the area and painful intercourse. But that will be addressed in a future Facebook Live to be continued.
Yeah. And another part, so Hannah and I have talked about kind of different types of internal pelvic pain, and sometimes those muscles are so tense and contracted that anytime anything tries to penetrate internally, it's almost that there's this extreme tension. So some women end up coming in and they've seen various specialists and they've been told, oh, their vaginal canal is just small.
Right.
And with any of the women I've seen, I haven't come across that actually happening. It ends up being that the muscles are so tense, it creates that feeling that it's blocked, or that nothing can go internal. And once we go through, so we're going to be addressing that next, different ways of helping to heal and resolve this pain, then they start to notice that these muscles release and that there is a canal and there's actually space. And all this time it's been that those muscles have been so tense, it's created this feeling that there's actually no canal.
Right.
Yeah.
Right. Mm-hmm. Yeah, and that also relates to what we talked about before about women asking for a children's size speculum because they have their children's size. When reality is that they just have they just have so much tension in the area that only a children's size speculum can actually fit in.
Exactly. Yes, so if you're just joining us, Hannah and I have been chatting about why internal pelvic pain happens, what the pelvic floor has to do with this type of pain. So if you missed that, make sure you go back and watch the replay after. But next, Hannah's going to be talking about, how do we heal internal pelvic pain?
So the first thing I wanted to talk to you about is anytime that there is pain, we kind of take a different approach now with these clients. We used to think that, like, you'd hurt your hands, then you get a pain signal to your brain and you experience pain. But we know now that actually pain is a danger signal. And although a lot of them will say, well, okay, if they've experienced abuse, they understand why their body's putting on, like, has this protective mechanism. But for some women, it really just is like postpartum or postmenopausal where they experience this. But if your brain kind of feels something and determines that it's dangerous for your body based on a whole slew of decisions that it makes, what it does, it actually creates this protective system. And one of our protections is to actually clench, right? Like, I know that whenever you go to the dentist, right, I'm like squeezing my hands and squeezing my toes, because that's the way that my body protects from what I perceive. My dad's a dentist, I love you. Something that's going to be not so comfortable. And so anytime that we experience that danger, the brain perceives as danger signal, what we do is we actually reinforce this protection. So, it hurts to insert a tampon, and every time something else touches the area, we go back into that protective system. What we do is we really reinforce that pathway between something touching the pelvic floor or the vaginal area and your body having to protect. So as physios, what we have to do is actually just kind of create a sense of safety, retrain the brain that these things are safe for the body. So I like to say it's just this amazing protective system that's just a little bit gung-ho. So we have to just kind of take a step back and retrain that tissue, that touch in the area is safe and not dangerous. Sounds kind of
exactly.
Sounds overwhelming, but it's usually somewhat simple to do that.
Yeah, exactly. And I think that's really good how you talk about it. And the pain receptors, are basically telling us, take your hand off.
Yeah.
But really, you put your hand on the burner. We have nerves at the end, and then they go to our spinal cord, upper spinal cord, to our brain, and our brain makes the decision of, Hannah, take your hand off.
Yeah.
This is actually not a good thing.
Yeah.
And you take your hand off. And I mean, that happens super, super fast. But how you're saying, if any other event happens, your brain starts to almost anticipate that it's going to be painful. Yeah. That's the other side of it too, right? That anticipating pain can actually elicit that pain response as well.
Because if your memories of touch in that area have been painful, then you start to expect that as well.
Yes. And talking about kind of that nervous system idea, right? The fight or flight response. Do you end up talking about that with clients, the fight or flight or the rest?
Yeah, absolutely. It takes you into, so what happens with a lot of people, what we see is we can't necessarily, when we're talking about pain, we can't necessarily just talk about the tissue that we're talking about. So yes, we do desensitize the area, but often we are in that fight or flight, and that system is so strong that we have to do things to kind of bring it down, either bring down your fight or flight, bring you out of it, or enhance your rest and relax system. And I mean, there's no earth-shattering ideas here, but it can be as simple as starting to, do something that brings on your relaxation response, something like yoga, something like just gentle breathing, which we're going to talk about in a second, Tai Chi, Qigong, like something that gives you like that, little breath of fresh air, gives your brain a chance to calm down, and is also something different for the brain to focus on that you haven't learned before. It can, so we talk about exercise, we talk about diet. Sometimes, like, you know, we know that your body does better when you're eating healthy. Sleep, relaxation response, like we talked about, drinking enough water. All of those things actually really contribute to bringing down your central nervous system and getting you out of that fight or flight. We also do specific things for the pelvic floor at the same time. And as pelvic physios, we actually can teach you how to kind of come out of that clenched all the time, how to actually release your pelvic floor. And one of our tricks, and we use this, we're like a one trick pony here, Anita, because we use this all the time. But if you want to demonstrate, what we actually do is we will use the flower bloom breath very often. We know that the pelvic floor works together with your diaphragm, with your breathing muscle. And your breathing muscle sits underneath your ribs, and it's kind of upside down U-shaped. And when you take a breath in, it descends down into your abdominal cavity and kind of encourages the pelvic floor to drop down. And when you exhale, it kind of moves back up. So that's inhale, exhale, inhale, exhale. And a lot of the clients that we see, especially if they've been in pain for a while, are breathing up here, right? They're breathing like this, and they're not tending to take in that nice diaphragmatic lateral breath that that we want, that's going to get those muscles going through their range of motion. So if you take a moment and just I'll talk you through, Anita, the diaphragmatic breath. So what you do is you place your hands at the sides of your chest. I call this the awkward angry hands, because, like, you know, when people are angry, they put their hands in their hips, but it's a little higher.
Put it right. So if you're watching,
I'll stand up here. So, okay, you're not going to be able to see my head, but so you're going to place your hands at the sides of your chest.
Right.
You're going to take a slow, gentle breath.
Oh.
And you're back, and you're going to exhale.
So I think Hannah's a bit frozen. We'll see. And so I'll just talk you through that flower bloom breath. So bringing your hands right up onto the ribs. So what you want to do is you want to take a nice inhale to open, and inhale out into your ribs, and exhale, let your ribs soften. So you want to think of that. Inhale to open, and exhale, let your ribs soften. And while you're doing that, the flower bloom side of it is you're going to think inhale, flower bloom. And basically you want to think of flower bloom out of your vaginal opening. So you're going to think inhale, flower bloom, as you're opening into your ribs. And then exhale, letting the flower just stay open. So oftentimes I'll tell clients, inhale to bloom, flower bloom, exhale, keeping it open. Then the next inhale, think of the same thing again. So you want to think open and then keep it open. And you're not going to feel a whole lot happening with your pelvic floor without someone pressing on the muscles. So you may just feel when you're doing this on your own, just that you're getting that breath in and then breathing out. And that's good. You don't actually want to think of pushing your flower out or bearing down, because that may cause other issues. So you just want to think open, exhale, keep it open. What Hannah and I can feel as pelvic physios is when we're internal and actually we're pressing on the various muscles, where there's tension in those muscles and we have you do that breath, we actually can feel your pelvic floor kind of melt and release and relax and stay relaxed. And as we do that more with you in our session, what happens is that tenderness or pain when we're pressing on it starts to come down, and that's a really good sign. And that's why we often use the flower bloom idea, because that's really what works for a lot of different clients. That type of breath and that visual cue can work really well for that. So that's a bit about the internal release. So depending on where the tension is, we as pelvic physios can go vaginally and be able to press on the various muscles. Or again, we may be starting on the outside right at the opening and not going internal. It's really important that if you were to see a pelvic physio, we're not there to push into pain. It's not a no pain, no gain type of situation.
We are not
pushing
getting
into the pain.
releasing.
Going back to what Hannah talked about with the nervous system, if you push into that pain and your pain goes way up and things are just becoming more painful and more tense, it's a cycle. And what will happen is your pain won't come down and your nervous system goes into that fight or flight mode, and things just become more intense and more tension, and it not help the situation. So as a pelvic physio, we're always getting feedback from you, and we're never going above a certain level in terms of how you describe the pain or discomfort, and we're looking for it to come down.
Right.
So that's really what the internal part is about. In terms of another way that pelvic physio, what we'll often talk about is, again, kind of working on decreasing stress or talking through different stress relieving strategies that work for you. And so every client is going to be different because everyone's stress triggers are very different, and depending where you are in life. So a new mom, those stress triggers are going to be different than a woman who's postmenopausal versus a woman who is in her early 20s who has never been pregnant and not had children.
Right.
So we're always working through with you and have you figure out what are little things that are going to decrease stress that we can implement throughout the day. Because the more often you can release this tension, the better. So in terms of the flower bloom breath, I'll often have clients be doing this, 5 times a day, 10 to 20 breaths. And we'll talk a bit more after about exercise specific that can be helpful. But lots and lots of flower blooms.
Like I would say,
these strategies for some women, whether it's certain music, for some of you who've had children, this may be similar to strategies you actually used in labor to help manage pain or discomfort. So, if it's certain music, I'll have women try to make a soundtrack of music that they find particularly relaxing and relieving. And for example, let's say
things that make them happy.
A new mom, when she's feeding her baby, she may have this music on just to help during that time decrease that tension. Or for others, oh yay, Hannah's back. We're just talking about stress relieving strategies. So I was talking about for some women, if music, that's something that I'll have them, make a playlist or try to bring that music into their day. For other women, it'll be mindfulness and meditation. And there's so many amazing free apps, free things on YouTube.
Yep. Message me. We can't push anything here, but we've got lots of good ones.
Yeah, and actually, if you stay tuned till the end in our resources, there's a really amazing YouTube body scan pelvic floor release that I recommend to a lot of my clients, and we'll make sure to include that in the resource. For some women, different scents are very relaxing, right? So lavender is something that can be very common. Other women have different scents, and now essential oils are out there quite a bit. So you may have certain oils or certain, lotions or other smells that just make you really relaxing, bringing those into your day. So really finding strategies. So that can be a great thing for you to already start today is, make a list of what makes you relaxed. For some women, baths are relaxing. For other clients I see, they hate the bath. So it's not going to be on your list, right?
I love it.
Heat. Some women love heat pads. Other women hate it. So you've got to find what works for you because that's going to help bring down your fight or flight response and bring up the other side of your nervous system. That's that rest and relaxation.
And what I'll say is also, as physios, we actually have a lot of tools and techniques to actually bring on that rest and relax. Sometimes the fight or flight response is so strong that by reducing it slightly, we're not going to see that huge, jump in the rest and relax. Sometimes we actually have to focus on that rest and relax system specifically to almost like if the fight or flight is up here, just to bring it up the rest and relax just to meet the demands. So there's a balance system again. And so it's really an individualized approach in terms of how we go about it. And sometimes it is a little bit of kind of work to figure out what really works for you.
Yeah, exactly. And that's why every session, if you're seeing a pelvic floor physio, at every session, they should be asking you, you know, what has worked, what hasn't worked, what have you been able to do, and let's, you know, progress or change things as needed. For what works. So Hannah, we talked about, while you were coming back in, we talked about the flower balloon breath and explained internal pelvic release. So we're seeing how vaginally, and I meant to mention as well, because of the back part of our pelvic floor, we also go rectally to release the back part of your pelvic floor. So depending what your needs are, there's various ways to address those muscles, plus muscles on the outside that connect into your pelvis. Now, do you want to talk about dilators and how that comes into play in terms of physio? Because some women end up getting sent to us that their specialist has told them to use dilators, but they often haven't used them, or they did try and they were.
Or we tried it and it was terrible, right? Yeah. So what we do with dilators, so a dilator is kind of I'll call it, it's like a penis-shaped medical device, but some women really prefer to have dilators because it feels medical, and it's that then they feel more comfortable with that. Other women will go, if they have something at home that they've used in the past, we'll have them use that. At the end of the day, what it is, it's kind of, it's a circular kind of, I should have brought one today, sorry. Kind of like a tube shape, and they basically go from a very small size, like some of them start as big as your pinky, and then they get wider and longer, and the diameter kind of changes, and it gets larger, so that what I use them for versus what a doctor or some specialist prescribe them for. Some do amazing jobs, some kind of miss the mark. But what we use them for is we call them accommodators now, Anita, because what it does is it allows your brain to actually sense that something is being inserted into your vaginal canal and we can actually down train that protective system in response to that. And so once you get used to kind of something that's very small, then we can go to the next size, next size, and hopefully work towards, you know, like I have some clients who are trying to get pregnant and they have pain with like an internal vaginal ultrasound, and their goal is to actually be able to have an internal ultrasound. Well, the largest dilator is the same size as that internal ultrasound wand, and so we make it there. Their brain sees that. You can kind of down train that response, and then they go off. They do what they need to do, and they're like, oh my gosh, that's magical.
Exactly. And I think exactly how you're saying, so often as pelvic physios, it won't be something we recommend day one often.
No.
We teach about how to use that breath, how to release, why it's happening, what's happening with the nervous system. We start with a lot of that work first. Sometimes for my clients as well, we get to a point where in our session, everything is released. There's no tone. They're at that kind of zero tone that we've talked about. And there's no pain when I actually check their muscles internal. But their reason for coming in was pain with intercourse. And how we've talked about with the nervous system, even though in my office, it's a completely different, you know, reason for their muscles.
Safety there, right? They know that it's safe and that you're not going to be pain. Nothing's going to hurt. That's our job as physios, right?
Exactly. So the dilators can be a great way to then work towards pain-free intercourse, because some women, even though, like I said, in our office, everything's released, everything's relaxed, when they go back into that particular event, or it's a pelvic exam, or whatever their goal was, their brain will still remember the last time I did this activity, it was painful. So why should this time be any different? And women notice, they start to tense up. So I educate them on
activity, kind of, right? We bridge between those.
Yeah, because using a dilator or accommodator, they have complete control over it. So it also is helping to retrain the brain that this is not harmful, that this is okay, that something is internal. So that's a way to bridge it. Oftentimes, I'll also have women initially, those first, whether pelvic exam, intercourse, those first few times, they're going to need to use that flower balloon breath. And if it's with intercourse, I tell them, or any sort of penetration with a partner, telling them you need to speak to your partner. And I ask them if they feel comfortable talking about that, if their partner is open to, you know, slowing things down, and that they're in complete control and using their breath, because that makes such a huge difference. If they're, you know, pushing, again, how we talked about It's not a no pain, no gain situation. So if you push past that kind of pain threshold that you've set for yourself, women find that they go back a little bit because their nervous system goes, wait, what? This is harmful. This is not a good thing. So keeping that in mind, that's also another way to use dilators. And I just want to send a shout out just before we go on is Helen, I hope I'm pronouncing that correctly. She said that she'll listen to us tomorrow on her way to work. Thanks for the info. So thanks, Helen. Please send any questions after you've listened to it. And then Mandy has asked a question. She says, some great info. Do you ladies know of any sexual health courses that health professionals can take other than physio? I'm a kin. With Belly Zinc, and hypopressives, and would love to be able to help women with this issue, as well as on top of seeing a pelvic physio. This issue is so common, which is so unfortunate. And I think it's amazing to have a kinesiologist mention this as well.
You must, first of all, Mandy, you must have like awesome relationship with your clients. So
yes, yeah.
Telling you about it.
I love kin. I did kin. Did you do kin, Hannah?
Sure did.
Yeah, so we both did kin before physio. So that's awesome.
Would you love kin if you didn't do kin before physio? Because I still think kins are awesome. Even if
kins are amazing.
Okay, just saying.
Yeah, well, I'm just saying we know what she's gone through in terms of schooling and the amazing knowledge she has. So awesome. So that'll be one of our resources as well, Mandy. We're going to post at the bottom. Pelvic Health Solutions has courses. There are internal pelvic physio courses only internal physios can take, but they also have a lot of other fantastic courses for any health professional. So whether you're a doctor, a midwife, a kin, a nurse, chiropractor, massage, that are external courses, because this information needs to become more aware and be much more updated. It's Hannah and I get really sad when we have women coming in and, they've seen specialists and no one has told them pelvic physio exists. And then we see them for a few sessions and things have completely changed. And so thank you so much for sharing this info with your clients. And I think you would absolutely love the courses through Pelvic Health Solutions. So if you go to pelvichealthsolutions.ca, and we'll post that at the end as well, a lot of fantastic courses.
And they have some, we'll talk about some other stuff about them later, but fabulous. So, I mean, let's chat about what all of our peeps really want to know. So,
exercise.
What kind of exercises can we do?
Yeah, and we've kind of touched on this already, but so
like every Facebook Live we give all the answers before we even ask the questions, but we love to talk.
And they all kind of just, go along with each other, right? So in terms of exercise, going back to that nervous system idea, types of exercise that bring up our parasympathetic nervous system, or basically exercises that are going to make you feel released. And what has been commonly known is actually a lot of types of yoga can be extremely beneficial.
Yeah, great research.
So if you're, so yin yoga, as well as restorative yoga in particular, those types can be quite helpful because they're a lot about releasing tension. Not to say other types of, and half as well. And not to say that the other types are not beneficial, but these ones in particular, because they're more about the release type of poses and more lengthening poses and focus on release work versus having some of the Ashtanga or more the power type yoga. So these can be amazing. And often, I know Hannah's the same as me, that once we introduce the flower bloom breath, what we actually have clients do is eventually start doing the flower bloom breath in specific yoga postures. So depending, again, on the individual and the rest of what's going on with their body, we're giving specific yoga poses, and some are modified. So again, with restorative, right, it's amazing. You're using bolsters and you're using yoga blocks and you're using other items to help you relax into the posture so that tension is just going out the window, and that's really what we want. And then you add the flower bloom breath on top. It's amazing. It works so well. It works really well. So that I would say was one of the key ones. And then also talking about exercises that may contribute to tension in the pelvic floor. And we're not saying this is for everyone. It's always an individual basis, but types of exercise that are really focused on tension or tightening. And for some women, doing a lot of strength work, if they're not aware of how to engage and how to let go, particularly their core and pelvic floor during it, if all they're used to is tension the whole time, that may be contributing to their symptoms. Or if you're watching this and this sounds familiar, it may be contributing to your symptoms.
But that's also, I mean, we, you know, women, people, everybody, they'll go to the gym, they have a half an hour, they have 45 minutes, they'll spend the majority of that time exercising, and how often does stretching go out the window? The reality is our body needs to be balanced, and I think this is a good reminder, whether or not you have pelvic floor tension or not, stretching is really, really important. You need to balance the system.
Yeah. And I often look at it as not even so much about just stretching, because that's a whole other conversation. Everyone has opinion on if stretching is beneficial. I look at it as taking that time to release tension in your muscles, whatever that may be. Because
whatever means dynamic stretching or even...
That's the thing, right? Because if you're in a stretch, but you're holding your breath and it's really painful to hold that stretch,
oh my God,
not get anything out of it, right? So I really talk to clients about it's not really about the specific stretch always. If you do want to do certain stretches, fantastic. Let's bring the breath into it so that you're really releasing tension versus holding a stretch and feeling really tense about it. And that's just not going to release any muscle, let alone your pelvic floor.
I love that concept. I love it.
Yeah. So I'd say those are kind of when it comes to exercise. I know there's so much more we can talk about as well, but I'd say, you know, different types of whatever's going to help release tension, and yoga has really been shown to be a big part of that, and various poses. So often we'll talk about child's pose, malasana.
It's my favorite pose, because you just hang out there.
And it's perfect, right? Being in that posture already helps to open the pelvic floor. Add your flower bloom on top, even better. Malasana, which we talked about when we talked about preparing for birth, so that really deep squat position, but using a yoga block or whatever supports you need so you can relax into it. All the various like warrior poses, triangle pose, like there's just so many that are so amazing to release tension in general in your body and lengthen, but also with your pelvic floor, and then learning how to use your breath on top of that just is really, really helpful.
And I think it's important what you just said as well about if you decide you want to release tension and you go to one of these classes, you know, the idea is not to push into the pain. The idea is to find a comfortable position where you find there's a gentle stretch or there's a gentle release, and this is not no pain, no gain. There is nothing about this that is go hard, go home. It is gentle and really a very subtle stretch that we're looking for, or a subtle release.
And I think we, you know, see a lot of women who come into our practice and who have maybe tried the no pain, no gain idea already and have realized it didn't work. So they're very open to this idea of easing into it and allowing your body to, again, how we talked about, understand that a particular movement or pressure is not harmful. And so their nervous system relaxes too. And that's when you really see results. So after as well, I'll post a flower bloom video that I did if you want to kind of review and watch that. But we also talked about it while Hannah was coming back. So make sure you go back and watch the replay. If you're just joining us now, we talked about why internal pelvic pain happens, how it's related to the pelvic floor, and the different types of internal pelvic pain, and then as well, how do we get rid of it, and exercise that can actually help. So why don't we go into some of our top resources that we love to share.
Amazing.
Yes. So one in particular, and I wish I had it with me, I know it's at my clinic space, but it's a book, and it's called Why Pelvic Pain Hurts. And it was written by 3 physiotherapists. One of the authors is actually a pelvic health physiotherapist, Carolyn Van Dyken, who actually taught Hannah and I. Oh, there we go. I really need more copies of this in my clinic.
Yeah, we've got a lot.
For it and come back, and then we have a discussion about it. But it's also available online, and if you're a healthcare provider, there's a way, so you can always message in terms of if you want to kind of order in bulk, we can send you to the right person for that. But it's fantastic. So it's called Why Public Pain, in particular for individuals who've gone through pelvic pain and persistent pelvic pain. So they've gone through this for a while. And then also, when we're talking about meditation, pelvic floor body scan release type meditation, and why I love it is when I found it, because it actually brings in the pelvic floor idea. So it brings your awareness to the pelvis, which a lot of body scans don't really focus on it. And so this one's by Fem Fusion Fitness. And so I'll post the link below. I send it to all my clients, and it's not very long, but it's super helpful.
Awesome.
So
awesome.
Those are some of my top ones. And then we'll also, the Pelvic Health Solutions website that has for clients who are looking for answers about the various types of pelvic, internal pelvic pain we've been talking about. So, yeah.
Awesome.
What are some of your favorite reasons?
So I love the Noi Group. They're from Australia. One of their researchers, his name is Lorimer Mosley. He has an awesome TED Talk. He's very funny. He kind of describes the central nervous system in like really understandable and relatable way. And it's called Why Does Pain Hurt? So it's an awesome TED Talk. They also have a book called Pain Explained. They just came out with a new one called Pain Explained Supercharged, which are amazing resources. I think one of the top ways to reduce pain is to actually be educated about pain. And so it's one of the first things that Anita and I do. We'll talk about it with you. We'll often give you one of these books, either Carolyn's book, or I'll tell my clients to grab the Pain Explained, or I'll have them get the book, The Pain Truth and Nothing But, and that's by a physiotherapist here in Toronto. His name is Baram Jam. It's also a really understandable, relatable book, and we know that once you kind of have some form of pain education, it actually helps with your pain experience. And so I think that all of these resources are amazing, and some work best for certain people, and others prefer, some people like the online stuff, some people like to have a physical book, some people prefer the manual, like what Carolyn's book is just a little bit smaller. And so just have a look through our resources and choose what works best for you. So at the end of the day, Anita,
yes.
Sorry,
yeah.
Cutting you off.
No, that's okay. No, I'm watching us live right now, or the replay after, so you'll be able to check all those out. Yeah, and the main thing, Hannah, and I want you to know is that you don't need to live with this type of pain, regardless of when you're experiencing it in life, and that there is the public health physio wherever you live. It can be really helpful. Finding relate with some training regarding pain. So if you're working with someone who hasn't taken courses, let's say in quite a few years, they may be talking about this differently. So finding in any specialists. So there are some amazing OBGYNs, urologists that we work with all the time who are really up to date about this information, and that we work together with to put up with it, and that you can change this.
Yeah,
there's
so much help available. Don't stop your search. We'll help you find someone to address it as well. So Anita,
Hannah, if anyone,
yeah.
So if anyone wants to find you online, or in terms of if they're in Toronto, how?
So people can find me at our website, which is vitalphysiotherapy.com. They can connect with us on Facebook. We're Vital Physiotherapy and Wellness Toronto. You can find us on Instagram. We're at Vital Physiotherapy and Wellness. And we are very responsive to questions, and we are absolutely thrilled to help you. Anita, where can anybody find you?
I will holistichealthphysio.com, and you can check out resources online there, or you can always find me on Facebook or Instagram at Holistic Health Physio, and be happy to answer questions and give resources. And feel free to private message us, like we said, with any questions you have after watching this. And so we wanted to let you know, so make sure you check out and like the Vital Physiotherapy and Wellness Facebook page and look page to stay up to date for our next Facebook Live, which we're going to be talking about our top tips that we talk about with clients for helping you heal and restore your fifth trimester. So basically those 12 weeks after birth, what would be the most helpful for you to do, and what information will help you with your healing process. So if you're an expecting mom, or you know an expecting mom, or you are a new mom, even past that 12 weeks, this can be really key, and you'll find a lot of helpful. Again, we're going to be sharing our favorite resources and lots of tips and information you can already start using at home.
Awesome.
So stay tuned for when our next one is.
Okay. Anita, as always, an absolute pleasure. Thank you to everybody who watched, and again, feel free to message below if you have any questions, or message us privately. Have a great night, everybody.